It's hard to tell you just what it's like to see the ravages of COVID-19.
Dr.
It's
Laura
not just
Harryluck
the
remembers
coronavirus
the exact moment in the
as much as
pandemic when she realized she was not okay, and it had nothing to do with her role in the intensive care unit.
I got a request from a friend internationally, and it was to develop or revamp some educational modules that we use. And I just remember feeling overcome by anxiety and panic.
As cases of COVID-19 decline, Canadians may be feeling a sense of normalcy, but on the front lines,
every person has their limits. And when those limits are repeatedly and continually stressed, it'll wear down even the most resilient among us. And that's really the situation that Canada's physicians find themselves in.
a survey conducted by the Canadian Medical Association beginning in October shows more than half of respondents reported experiencing symptoms of burnout, 1.7 times higher than 4 years ago. While the focus is on physicians, the crisis extends to other healthcare workers, including nurses.
They often do not get a lunch break. They don't get a coffee break. They have to stay late. They have to do doubles.
Half of the survey's respondents say they're dissatisfied with their work-life integration, meaning they don't feel they're meeting personal and professional obligations. An overwhelming number say they aren't professionally fulfilled. Yet physicians work more hours in an average week than any other Canadian employee, with medical residents spending the most time on patient care.
When there are staffing shortages, it inevitably means that the clinicians who are there have to work longer hours.
Family doctors and primary care clinics in BC are getting a $118 million boost from the province and Doctors of BC. But countrywide, physicians are calling for longer-term solutions.
I couldn't keep up with it.
Dr. Darren Markland recently gave up one of his two specialties. A lack of support, he says, continues to cause him stress.
I look at our Alberta Healthcare Board and there's no physicians on it. Right? We have lawyers and business people. That tells me what direction we're going in. I'm terrified. I know they don't have my back.
Caryn Lieberman, Global News, Toronto.